Welcome back. Antibiotics are one of the more common and important tools when it comes to saving lives. Recently, there has been some concern, though, about developing a resistance to these medications, and that's where Infirmary Health is coming in. We have Rachel Foster and Chris Whitman here to talk about the Antimicrobial program at Infirmary Health. Thank you both for stopping by. I was asking you just before this interview, do we really need to explain what antibiotics are? And you said surprisingly yes.
Yes.
What are they?
Yes, it is so kind of surprising, the misconceptions that are still out there, and that's part of what we try to help fight. Yeah. So antibiotics are medications that are used to treat infections that are caused by bacteria. So when a bacterial infection is strongly suspected or confirmed, a provider will prescribe one to help kill or suppress the bacteria. And antibiotic prescribing is a lot more complex than what it likely may seem. There's a lot of different factors that go into choosing really what the best antibiotic regimen is going to be for every specific scenario.
So we were also talking about how doctors aren't as quick now to prescribe antibiotics when there is an infection present, kind of letting the body, do what it's supposed to do and let that infection run its course. Does that tie into the stewardship program that you have at Infirmary?
Yes, that's the foundation of the stewardship program. So ultimately our goal is to optimize the use of antimicrobials to prevent antimicrobial resistance. Our goal is to really focus on the best use of antibiotics, not only in our patients in the hospital at bedside, but the patients in the community, because it's going to affect our, the generations to come. Antibiotics that we use today aren't guaranteed to work tomorrow. So really the antimicrobial stewardship program is more than just the ID pharmacist, but it takes a village. It's us, it's the IT folks, it's the microbiology lab, it's the nurses, leadership in the hospital. It really takes a village.
I remember when there was an overuse of hand sanitizer in combination with antibacterial soap, and they were like, don't do that, you're creating super germs. I know that's on a different scale, but in terms of the long-term risk, what is your biggest fear? You touched on it with saying that, it could lead to resistance.
Yes.
Yeah. Resistance is very relevant in this community and globally, as we see more and more occurring. Antibiotics are unique from other classes of medications, and that the more we use them, the less effective that may become. And so as we see more and more of these resistant infections, often we're left with little to no treatment options, and that can lead to all sorts of different negative consequences, such as increased hospitalizations, increased costs to the healthcare system and patients, increased risk of adverse effects from having to use alternative management strategies, and even increased risk of death. And so that's why at Infirmary Health we're really trying to prioritize being good stewards of antibiotics to help be sure that we're ensuring the best outcomes possible.
Awesome. We are just about out of time, but is there anything else you want to add? Really, just
Antibiotics are a public shared resource, and really just be smart with your antibiotics at home. Don't use each other's antibiotics, and you can question your physician about, is this the most appropriate therapy? All right. Well, thank you both for stopping by. Important information there.